Bienvenidos. Welcome to the first edition of Adelante. My name is Sofia Carrillas, and it is my pleasure to be with you today and to be hosting the first one of these forums. I'm excited about the possibility of this forum. I think it's innovative and creative, and it'll provide a valuable resource for us as clinicians and the bilingual community as a whole. For more information on my topic today, I will be posting a reference sheet with websites and articles that you can seek more information on. So I'll be posing 3 questions to you today. Number 1, is bilingualism detrimental for children with autism? That is the million-dollar question right now. The language of intervention has always been a controversial topic for bilingual speech pathologists. It presents us with a lot of challenges. Children with autism and Asperger's present us with even more challenges in this area. One of the hallmark characteristics, as we all know, of this disorder is severe deficits in language use, pragmatics, and sociability. Pragmatics and social skills are very hard skills to teach. So what's appropriate in this case? If the social norms of the child's home language is very different from the social norms of English that he's learning at school. So that's the topic I want to present on today. In the past few years, I've seen an increase in my caseload of children who have autism or have been diagnosed with Asperger's from different cultures and different linguistic backgrounds. Recent prevalence surveys suggest that autism has become much more common in the past 10 years, and recent census data suggest that there's a very increasing high number of children from multilingual backgrounds entering the public schools in the United States. So this would explain the rise that I've seen in my caseload in this area. I wanted to know what the best practices would be for children in this area. I was seeing a lot of colleagues and parents coming to me with this scenario. They were being advised by other therapists and other physicians to only speak English to children with autism and Asperger's, for fear that it might be an extra burden on their language problems, or it might further confuse the children who are already having trouble with language issues. Question number 2. To be or not to be bilingual? Children with autism and Asperger's have a lot of trouble generalizing learned skills to new situations. Thus, it is often recommended to parents to not further the child with having to learn a language other than English. Now, on the surface, this makes sense. Children on the spectrum have trouble with language. They have trouble socializing and using language in different social situations. So again, on the surface, this makes sense. We don't want to confuse them. I don't think that other therapists or other physicians or whoever is making these recommendations have any malicious intent. I do think that they are looking out for the best interest of the child. But there are other things to consider when working with this population and taking on the philosophy of an English-only intervention. And that's what I want to address here today. Other things that we can take into consideration when we deal with parents and advise them on English-only interventions for this population. There is not a lot of research in this area. There are several case studies and some research that has started to touch on this topic, but no in-depth long-term studies. So the research and the articles that I did find on this topic found no research evidence to suggest that hearing more than one language worsens the symptoms of autism or Asperger's, and that these children can actually learn both languages. The current literature actually suggests an approach of extending language by allowing a child to use both his home language and his school language, rather than a limiting approach. This type of approach is also supported by theories of second language learning, mainly Cummings' threshold and cognitive development interdependence hypothesis. Now that's a mouthful. This particular theory by Cummings warns that if language 1 is impaired in some way, it'll place limits on learning language 2. So that's something to be discussed with the parents as well as our colleagues. How much will the child really gain in language skills if their first language is not brought up to a functional level? Question 3. Family-centered practice. When considering an English-only approach to intervention with children with autism and Asperger's, we have to think about family-centered practice. Advising a family to use only English may not be the most family-centered approach. This literature that I did find on this topic suggests, and my own personal experience suggests, that it's very different for parents. It's very difficult for parents to change the language they've always spoken. And to suddenly have to speak English at home is very difficult. Parents have cited scenarios such as speaking to their diagnosed child in English, in limited and broken English, and speaking to their other family members and spouse still in their home language. So basically, the language impaired child, in this case, is left out of family conversations. The families had to change the activities or limit the activities they do in their home language, such as going to church or attending other social functions in their culture, because the child could not be exposed to that sort of thing right now. So one has to consider what effect that has on the family, how detrimental that might be to the family as a whole, and if we don't want to confuse the child on the spectrum, can you imagine how confusing it would be for him to hear his home language, his parents speak his home language, and then speak something else to him? And this child with autism Asperger's already has difficulty socializing and connecting to people. I can only imagine how frustrating and confusing it would be to not be able to connect with the rest of your family or your culture in this case. So again, that needs to be considered. When dealing with children with autism and Asperger's, we may have to think outside the box for therapy. We may need to do things like tape the therapy sessions and send them home so the parents can practice the skills. Invite the parents to come join the sessions. We may have to be much more involved with these parents than we are with our other parents. So it forces us to think outside of the box when dealing with children on the spectrum from different cultures and different linguistic backgrounds. This type of approach might also make us examine our own personal biases towards therapy, towards the process, and towards different cultural groups. The literature that I did find also suggests that there is an over-identification of autism and Asperger's of children from cultural and linguistic diverse backgrounds due to differences in social norms. So the importance of sharing information like this is very important, not only in intervention but in assessment of children with autism and Asperger's. Okay, so those were my 3 questions that I posed to the group. Now it's your turn. I want to hear from you. I want to hear what your experiences have been with children on the spectrum from diverse backgrounds, and what you found works best for intervention approaches, and have you included the family? I would just like to hear what your experiences are. I know it's been on my mind lately, and I'm sure it's been on somebody else's mind too. So I look forward to hearing from you, and as our name says, adelante.